Hello and welcome back to Mother Tongue, your eyes, ears and finger on the pulse for all parents around the world. Let's get going, shall we?
So today we're talking all about healthcare and medical facilities in the kingdom, which I'm actually genuinely quite intrigued about because, as you know, having had a child in Dubai, I'm astounded how good the healthcare is in this part of the world. Like I really am. It is honestly second to
Incredible.
none. And I think the whole visa situation helps. And I'm guessing it's very similar in Saudi in the sense that you're not allowed to stay in the country unless you have a visa. You don't get a visa unless you have a job. And then your company pay for your healthcare. And if you are a wife who isn't working, then your husband's work will pay for your visa and your healthcare. So essentially, all healthcare is paid and private.
Yeah, which is huge, right? And actually, I think about this quite a lot because what the Middle East has done by default is given us private healthcare and private education for the kids. And that's
Yeah.
just mad, isn't it? Because
Yeah.
in England, that just would not be a reality for me at all if we'd stayed in London, for example. So, incredible reason to move to the Middle East. There we go.
No, I
Mic
agree with
drop.
that.
Done. But for Saudi, yeah, exactly. So everything is private. So we have some incredible hospitals here. There are governmental hospitals here, but obviously as expats, we don't tend to use them. I do have a funny story though. So there was a Palestinian lady that desperately needed some blood, and I was her blood type. And I thought, right, I'm going to go and do it. I'm scared of needles, but I'll be fine. I'll go do it. So it was at a government hospital, and I got there, and I'm not joking. I thought, this is just horrible. I'm not going to be able to do it. But I did it. Then as I left, so gave all the blood, as I left, I fell over my own foot. It was not a consequence of giving blood. And I sprained my ankle, and they
Stop
were
it.
all running at me like, oh no, she's collapsed off giving blood because she was so scared. And I was like, no. So I got wheeled to the government hospital A&E because I was obviously already on site. So I was going through this whole like governmental experience that I was definitely not supposed to be having that day, but it was great. But they really looked after me. But no one spoke English, and I was really giggling at how this had happened. But yeah, I'd sprained my ankle. Trying to do a good deed. But yeah, so I usually would go to the private hospitals here. So we have a really amazing group of hospitals called Salaman Al Habib, which is a big group of hospitals. So there's a Takahusi branch, there's a Sahafa branch, Olea, Ryan, lots of different areas, all specialising in different things. There's also what they've just launched, which I think is incredible, is a female-only clinic.
Oh,
So
wow.
all doctors are female, all the patients are female, and it's obviously very gynae, new mum, women focused, which is so great to see and hear.
Yeah, that's amazing.
So that literally just launched a couple of weeks ago. So yeah, the medical is incredible here. I couldn't fault it, to be honest.
And obviously you've had one baby in Dubai and then you've also had one baby in Saudi. Can you talk me through having a baby in Saudi? I'm very intrigued.
Yes. So my daughter she is an Amira. She is a Saudi princess in her head. She's actually not allowed Saudi nationality, but in her mind, she's got it. So she was born in a hospital called Kingdom, which again probably further cements her narrative of the princess vibe. It was honestly the most amazing experience for many reasons. I had my son in Dubai in Zara, what's it called? Zara something
Al
hospital?
Zahra Hospital.
Al Zahra, yeah. So I had him there, but he was an emergency C-section, and the whole birth was quite horrendous, which I shouldn't say to you because you're pregnant and just about to have a baby. But it was not a smooth birth, and ended up an emergency C-section. And so for my daughter, I chose to do elected. Two reasons. One, she was just 2 under 2 vibes, so they don't encourage you to go in for a VBAC then. And then I also I had a toddler, right? So I just wanted a very smooth, not easy, because none of it is easy, but just like a very logistically organized day, which is really what I got here. So
Yeah.
I knew the day I was going in, I knew the time I was going in, I knew when I'd be out, I knew when my son could visit, I knew where my husband would be. So it was very, very organized. And that for me was exactly what I needed with my second child. So had her here, the most incredible experience. The only thing I would say is, FYI, when you're having a C-section in Saudi, many of the hospitals will not allow your husband in, which I think is really important to know, because if I didn't
Oh,
know
wow.
that, yeah, I would have been quite upset had I only found that out in the moment or on the day. So that is a huge risk of having a natural birth here that then could obviously turn into a C-section. And if it's one of those hospitals and you weren't prepared for that, your husband wouldn't be allowed in the room. So we chose Kingdom. They do allow the husband in. I don't know if it's insurance reasons, religion, cultural reasons. I'm not sure like what it is, but for some reason in Kingdom you can. And also my doctor was a man. So that may be part to do with it as well, because obviously there's a man already in the room. So I'm not sure 100% the details, but that's the case. Whereas I know Sullivan Al Habib, for example, doesn't allow the husband in certain clinics of their branches. So yeah, different in different hospitals. That's definitely something to look into when you get here and you're thinking about having a baby.
That's so interesting. And in terms of like the whole experience of, what are the hospitals like? Like, are they quite smart? I mean, for example, hospitals in Dubai, it's like checking into a hotel for the weekend. It's very, very, very luxurious. Is that a similar kind of vibe?
Not yet. So when I was having Mika, no, but still very like million miles away from an NHS ward, shall we say? But it wasn't as bougie as so now we have Solomon Al Habib Sahafa, which is like a Mediclinic vibe, like in Dubai, like very clean, massive, like sparkly almost, aren't they? They literally look like they have a shimmer to
Yeah,
them.
exactly.
That's what this new one is like. So that's definitely more in tune with the Dubai experience, I'd imagine. But Kingdom was great. Like you get your own suite, for example, when you have your baby, which I loved. Space for your husband to stay the night. In fact, the suite was huge. It had 2 rooms in it.
Wow.
Yeah, and another really interesting thing for having a baby here. I mean, we could do a whole episode on this, honestly. They take the baby away from you. So when
Oh,
you
wow.
have the baby, there's not so much emphasis on skin to skin. You have to really push for that if you want that. I, with my second, was less worried about it by my own, everyone's so different, but I knew in myself that I often, with my first and my second, I've kind of needed a minute to collect myself before I need the baby. It's almost like I'm like, okay, let me just have a second. Let me just concentrate on what's just
Yeah.
happened and then give me the baby. So for me, they took her off. They did the tests in the room. I don't know what they do, give them a little slap on the bum and kind of get them cleaned up, get them dressed up. And then they gave her to me. And to be honest, that's exactly what I needed. I needed a minute to just be like, right, I've just had a baby. This is what's happened. You're being stitched back up after your C-section. Like, just breathe. And then they gave me her nice and clean, very calm, very chilled. And then I had her for the rest of the time. But there is a nursery where they take her back and forth. And again, they're just very chilled. Like they have so many women here have babies. Like a lot of the families are huge here. Like my friend's husband is one of 9. They have so many babies. So when I was meeting some of the ladies in our area that were having babies, I was like, how many are you on? They're like 4, 5, 6. Like, God, this is 2. I'm good. But yeah, so it's definitely, they're very not like blasé, but they're very like, they just kind of take the baby off, clean them up, bring them back. They'll, like, for example, one of my friends, she hadn't specified breastfed or bottle fed, so they just gave the baby a bottle because they're like, we're just cracking on. Whereas she was like, oh, hang on, no, I wanted to breastfeed. Whereas for me, I think I was as chilled as the Arabs by this stage. I was like, yeah, like if she wants milk, give her, clean her, like whatever. Like, and then maybe it's a second baby thing as well. When you've had your first, you're much more highly strung about what's going on. Whereas I feel like with the second, you're like healthy, happy, great, So yeah, it was a very, and it's all, it was quite a chilled experience. Does anyone say that about birth? But it was, it's just very chilled. Yeah. And
And what about
honestly,
things like lactation support and pediatrician support and stuff like that? Is that all quite normalized and readily available?
yeah, so there was one lactation consultant who came in to see us. And honestly, I straight away had said no need because I knew she was going to be bottle fed out the gate. So for me, not needed, but she does come in and teach you if you want to be taught. And there's a great company here called Mum's Way, which she's a doula, she's a lactation consultant. She can really help. She helps a lot of the expat and Saudi community actually. So she's really fantastic. So there is that support here more than there perhaps was when I had my daughter. And pediatrician, there is the most gorgeous, loveliest man. He's called Dr. Locker. He's based in Kingdom and he just adores kids. And do you know what I love about him? He gives you his WhatsApp. So anywhere in the world, I can message him and say, look, Mika's gone grey or MJ's done this. And she'll say, I can message him and say, you know, this has happened, and he'll always respond, and he doesn't need to do that. You know, it's really going above and beyond when it comes to care. So we're really, really lucky here, I think, with medical. And then the other thing I would say is with having a baby here, you can stay in the hospital as long as you kind of need. The insurance covers it. So I stayed probably way longer than I should have just because I was having my best time. But yeah, they looked after me, they looked after the baby. I felt completely looked after, but there is no midwives after. So in England, you'd have a midwife, wouldn't you? Whereas in
Yeah.
Dubai, do you have them in Dubai? Not sure.
Not midwives per se. They're starting to introduce. There's companies here now where you can kind of have midwives come to your house, which again is really new. Like the last year, 2 years. In the hospital, you'd have a nurse, but they're not midwives necessarily. They're not going to help you with feeding and stuff. They're very much there to kind of make sure that you're fine, baby's fine, and that's it.
Yeah. And when you get kind of sent home, there's nothing after that. That's a
No, you
really,
go back
yeah,
to the doctor to see, you personally as the mum go back to see your gynecologist, and then for the baby, you then go straight to the pediatrician.
yeah, which is mad, isn't it? Because you've just had a baby and it kind of forces you to get back
I
out.
know,
Because
I
I
know.
suppose in England, you could just start to like bury yourself into home and like
Yeah,
make yourself, but actually in the Middle East, you're like, no, get out and get that
yeah,
baby back to the hospital and yourself
yeah.
shuffling along. So, um, but yeah, it's very different. But I would say it's a great place to have a baby and a great that medical in general here. Like I find so for example, I had a boob check the other day, and I had my results within 2 hours. Like that's
Yeah,
insane.
it's very quick.
Yeah, so that it could be 24 hours, but I just got really lucky that day. But they're really, really great at kind of, and you can go in with anything. You can go in and say, I have something that's completely made up, and they will take the time to help you. Like they're so brilliant, and they're open honestly nearly like 24 hours. Like they might even be open 24 hours. The hospitals here, they're open so late, and in Ramadan, obviously, they are open all night. It's yeah, interesting.
I love this. And you also, I know that you personally have had a few issues with Mika and her asthma.
Mm.
Um, how has that whole process been handled? And have you had many trips to A&E? How has that experience been?
So many, so many. But do you know what's interesting? People say to me, "Oh, it must be the dust in Saudi. It's very dusty there." It's actually not. The worst attack she's ever had was England. The worst I've
Really?
ever been in A&E. The most critical she's ever been was England. So
Oh gosh.
it's not reflective of being here. She has viral induced wheezing, which is effectively up until the age they can call it asthma. And she really, really struggles. So if she gets a cold or a virus, a normal situation with my son where it's a cold or a virus, I wouldn't lose sleep over it. I'd just get Calpol in him and get on with it.
Yeah.
Pretty immediately, I have to get her on a nebulizer
Yeah.
just to really help. And that's great here. So they all on insurance. They've given me a nebulizer for the house. They've given me inhalers. They've given me all the salines, the steroids, everything I need to get on top of it. So over the last, I'd say 6 months, I haven't had to, touch wood, take her to A&E. I've managed to get on top of it at home because of them giving me these amazing things. And there's a thing called Predo, which is a steroid. syrup, which I give her now if she even remotely starts to get a cough. So that's really, really helped. And again, like the educational piece, like they've really held my hand through it, which perhaps I wouldn't have got at home. Because obviously the NHS is so difficult at the moment to even get an appointment. Whereas
Yeah, exactly.
here, you can go on an app, and an hour later you can be with your doctor, which is another thing to point out. You don't have to rush to A&E as much because you can just get to the doctor as quickly, whereas it's not a case of calling at 8 a.m. and hoping for the best.
Yeah.
So yeah, so that's really great. And then yeah, A&E here is amazing. There's hospitals all around. So there's one really close to me called Mowaset, which I can get to in a couple of minutes, or Kingdom, which is the one we had her. So I can get there really fast. And yeah, they're all hands on deck, and they've always been so brilliant. So I can't complain at all.
And what about ambulances and things like that? Like what is the emergency number to call for a fire or for an ambulance, for example?
I
Shall I
actually have
Google
no
that
idea.
quickly?
Yeah, I think it's 991. So if you want to call an ambulance, you would be calling 997. If you want to call the police, it's 999. So I honestly wouldn't get in an ambulance here, if I'm telling the honest
Oh,
truth.
really?
Um, Honestly, because the traffic's so bad. So for me, I just wouldn't. I just can't see that. So we had to call an ambulance on our compound once, and they take so long. So for me, if it was the kids or me in a situation, I would just drive us straight to the A&E. That would be my
Right.
advice. I wouldn't wait
Yeah.
unless it's critical and you need an ambulance.
Yeah.
I would try and get yourself there. Um, because it's probably not going to get to you quick enough to then get back. Like I see them sometimes sitting in traffic with their sirens on and their lights. Yeah, really tricky. So I would say try and get yourself there. Also, something to note, which someone once told me, which I think is really interesting, is I had a lady collapse holding my hand in a coffee shop
Oh my
maybe
God.
6 months ago. She just came up to me, and she's a Saudi lady, and she held my hand. She said, "Look, I don't feel well." And I said, "Okay, like, do you want to sit down?" And in that moment, her eyes rolled back and she's gone. So I we called an ambulance. Lots of people trying to help. Amazingly, there was a doctor that we shouted for, and he came in this mall. But the ambulance took so long, so I kept saying, "I'll just get her in my car. I'll take her. Like, we just need to get her to the hospital." And the strong advice was, don't take her yourself. If you don't know them,
Yeah.
don't put some stranger in your car center, because if something happened to them on the way,
Yeah.
that would then be your responsibility. So
Yeah.
things like that, it's just about being savvy about, how you behave here.
Yeah.
And just being conscious as well, she was a woman and she was covered. And to just be mindful that her headscarf kept falling off, and the Saudi girls kept putting it back on for her. Just all these moments of just
Yeah.
being really culturally aware.
Yeah. So true.
So yeah, and like, if I was in an emergency situation, for example, and I needed to get to the hospital, grab a dressing gown if you're in your pajamas, like stuff like this. Just be mindful that you are also still in Saudi Arabia.
Yeah, agreed. And then speaking of like good doctors, I mean, you mentioned Dr. Locker here, who was a pediatrician. Are there any other doctors that you would really recommend that you love?
Yeah, so Dr. May Aldeen, who is at Solomon Al Habib Sahafa, she is incredible. So she is a family medicine doctor. She's a GP effectively. And she's just great. Like, I go to her with a list of 10 things, and she's the only doctor in the region, I swear, that doesn't give me any medicine. When you go to doctors here, because obviously it's an insurance, you'll come out with
Yes.
bags full of stuff, bags
So
full of stuff.
true.
My medical cabinet in my house is wild. I don't know what any of it does, but I've got so many boxes of this, that, and the other. She doesn't give me anything because she knows I'm a hypochondriac. So she is wonderful at saying, actually, none of this exists. You're good.
You're not dying.
So yes, don't you worry. But equally, she's very, like, I honestly once went to her and said I had a rib pain. And so we did ultrasounds, we did all these different tests, and there was nothing to be found. So she's great as well at like putting me through things just to put my mind at ease. She's
Yeah.
honestly brilliant. So May Aldeen, And then there's a really great doctor at Kingdom called Dr. Maha, who is a surgeon but specializes in breast. So he is the guy that I always go to for my boob checks. I'm trying to think who else. I just had laser eye surgery. Really great experience at Salomon Al Habib as well at Takahisi. So yeah, I've got a little black book, definitely,
Of a few that you
of
love.
people, yeah, that we use.
And then medical insurance. I mean, again, this is probably something that you don't get to decide for yourself because, as we mentioned, your companies kind of give it to you. But in Dubai, there is very much a sliding scale of good insurance versus not so good insurance.
Mm.
Are there any like insurance companies that you would say are very good?
Yeah, so we're Bupa, which is obviously great for Saudi coverage and global coverage. But there's some local ones, and I know a lot of the big Saudi companies here are transferring them from the likes of Bupa to the more local companies. Still great coverage, but I don't know of any others, to be honest. I just know that, like you say, when you move, your company will align you to an insurance company, and most of them are
Okay.
great, but most of them don't have dental, which is something to know.
Okay. All right. That is good to know.
Yeah.
And what
Mm.
about things like alternative medicine, mental health support? Are there facilities to support those kind of practices in Saudi?
Yeah, so there's a place that's just opened called Airfee Centre, which
Okay.
does osteopath appointments, does acupuncture, more physio based, which I hadn't really seen anything like that here before.
Amazing.
And then lots of like massage places where they really have incredible, like I have an amazing Filipino lady that I use that often like burns ginger and like puts it all over. It's very like holistic approach. She's amazing. So, and acupuncture, she does that as well. So there's definitely nods to that. Mental health, not really. There are therapist centres, but I haven't seen a huge moment for that mental health piece yet, like you have in the rest of the world. But I
Yeah.
think it will come. I think there's more awareness of it now than ever. I think it
Agreed.
definitely, as with everything in Saudi, it's changing so fast. So yeah, I do think there's a lot more of that coming.
Amazing, amazing. And again, before we round up today, if you were to leave us with some top tips or any nugget of information, what would it be around kind of healthcare and medical in Saudi?
I would say if you're coming here, enjoy the experience of having private healthcare. That's such a luxury and definitely not something we should take for granted. And I would say, especially around having a baby, enjoy that because you get scans more than you ever would if you were in England, for example. The
So
way that
true.
you can see your baby every month. I mean, I used to just drive past and want to pop in, like be like, can I see her today? Like it's just such a lovely, luxurious medical, offering that I just think again, like just don't take that for granted. Enjoy it and the
Yeah.
moments that brings, and really take advantage of it. So, get your moles checked, get your boobs checked, everything that you can. Do it while you can and while it's covered.
Yeah.
It's just really important to just maximize on it.
No, I totally agree with that. And Frankie, as always, can you just tell our lovely listeners where they can reach out and find you?
Yes, so I am at Frankie with an IE Hilton X on Instagram.
Love that. Frankie, until next week.
Speak to you soon.